For instance, they use it a lot of combination treatments, especially with some devices like microneedling, radiofrequency, etc. Okay, but if you check Dr. Selby clinical use of Lenisna, he has been using for a lot of years this product, and what he is telling us is that the product has excellent results because PDLA has weaker degree, creating a strong acidic state around particles than PLLA. So its tissue compatibility is superior to that of PLLA and is hydrolyzed faster than the PLLA, has a glass transition of 25-60 degrees, which is about 10 degrees lower than that of PLLA, and disappears from the skin in about 1 or 1.5 years. Other studies are talking about 2 years. Okay, another doctor is sorry, this is pictures of before and after, is Dr. Selby. Okay, and sorry, another doctor is the Seo Asong. Both of them are Seo, but are different. Selby and Seo Asong, and this is another doctor that has been working with more than 10,000 vials of Juveluc, and the biggest advantage of Juveluc for this doctor is the possibility of nodules formation is extremely low. He has been working with the products, putting 1 or 2 vials at a time for skin tightening, injecting in the shallow layers, repeating the procedure 2 or 3 times, and with excellent results. We can share with you the clinical experience of these 2 doctors from South Korea who has been using the product for a long time. This is another interesting study comparing both sides of the faces with 2 different PDLLA product, and they show more or less the same efficacy. Okay, and let's go to some advices. When you use it as a skin booster, in Juveluc, you have to dilute in 10 cc. You can use 1 cc of non-cross-linked hyaluronic acid, 1 cc of lidocaine, and 8 cc of water for injection. Okay, but the advice is long hydration time. That is good to use thinner needles up to 1 week before, and you can use up to 32G needles, even 34 when are with the ultra thin wall technology. The depth of injection is less than 1.5 millimeters. This is very, very superficial, and you have to put between 1 and 3 treatments with 3-4 weeks interval. This is a skin booster, and in this indication, you can only use Juveluc. Please, never Lenisna. When you use for a stretch mark, you can use both Lenisna and Juveluc. The proposal of these experienced doctors is Lenisna, diluting up to 18 cc, between 15 and 18 cc. Okay, and sometimes they mix with calcium hydroxyapatite, whatever. I have no experience with mixing with calcium hydroxyapatite, but I have experience combining with radiofrequency microneedling. I don't have Potenza, I have Morpheus, and the combination of Lenisna with Morpheus has excellent results in stretch marks. You have here the indications, and we can share it, of course, later. For acne scars, there's a different indication if the acne scars are shallow, are very superficial, or are very deep. In deep scars, Lenisna. For superficial or shallow scars, Juveluc. Okay, intradermal injection with 27 to 30 G needles in the case of Juveluc, in the case of Lenizna, a little bit deeper. How much? You have to inject enough to flatten the scar, and how many injections depending on the scars. Okay, for the eye contour, always Juveluc. Never inject dark circles with Lenizna. You can put Juveluc diluted in 10 cc. Okay, I'll show you some pictures in the next slide. And with Juveluc, there's the technological advantage that you can inject with 2 linear retrograde administrations of 0.1 milliliters of the dilution in 10 mLs. Okay, and another point of entry of my cannula is from the side of the cantle of the eye. Okay, total amount per side 0.5 milliliters. Okay, 0.2 in this entry point and 0.3 in this entry point. That means that you only inject 1 ml of the 10 ml vial. You have enough product to inject 10 dark circles with 1 vial of Juveluc. Okay, when you use it as a skin booster, of course, you can inject in the forehead, in the perioral area, in the cheeks, with intradermal injections, with bolus very, very small. And even if you have an automatic injector, you can use it because of the small size of the microparticles of the Juveluc. And of course, you can say these are studies from the company, or these are studies from doctors that use a lot of the product. Maybe they have some interest or some conflict of interest. Maybe myself have some conflict of interest, but this is a chapter of a new book of facial volumization with fillers. And if you check the chapter of the polylactic acid, they talk, of course, about Sculptra. Is the product that has been in the market for many years. But they talk, when they talk about polylactic acid, they only talk about Sculptra and about Lenizna and Juveluc. Regarding the dilution volume, Lenizna is reconstituted with 6 ml. In this book, they talk about 6 ml of distilled water, to which 1 ml is of lidocaine. Okay, and in the case of Juveluc, they recommend the reconstitution of 4 ml. But they talk about it can be helpful to use a vortex generation to agitate the vial for approximately 20 minutes before the injection to reconstitute the product. Even 1 day or preferably 1 week prior to use, they put it in the book, can be stored at room temperature and with no problem. Okay, even 3 or 4 weeks in a refrigerator. And important thing in this book, they talk about the biggest advantage of Juveluc is its ability to be placed directly in the dermis to provide skin tightening, as it involves minimal risk of nodularity, even when placed very, very superficial. And the advantage of Lenizna is the minimal risk of nodule formation, even when placed superficially into the skin, with a lot of bibliography in this book. Okay, we can share with you this chapter of the book. Talking about body treatments, I'm checking the time. Okay, if you are only going to read one article of body treatments, I recommend this Brazilian article. They are talking about buttocks, about thighs, arms, abdomen. And the important thing of this study is you can put it however you want. You can use needles, you can use cannula. If you check in the neck, they recommend with needle at the left side, letter A, or with cannula, or in letter B. I'll show you some videos if we have time. In the décolleté, you can use with needle or with cannula. In the inner side of the arms, the same. You can use with needle or with cannula. In the abdominal area, the same. You can use it in the way of the injection, retrolinear injections with needle or panning with the cannula. Okay. The same in the buttocks and the same in the thighs. Okay. And talking about Lenisna, this is the CE mark, the information in the vials versus Juveluc. Again, the difference between Lenisna and Juveluc is of course the amount of the hyaluronic acid and the polylactic acid, polydextrolactic acid, but the difference between them is the size of the particles. You have to remember this. This is very important, and that is what explains the different indications. The Lenisna has up to 100 microns with a medium size 47 microns, but the biggest particles of Juveluc are half size, are 50 microns with a medium size 23 microns. Okay. And are round shaped microparticles with the inside porous. Okay. We repeat this because this is important. Okay. That is what explains the safety of the product. These products are safer than other polylactic acids present in the market. Maybe the result is similar or little shorter, but they are safer, and this is reported because the nodularity and the rate of granulomas is lower. The PDLLA particles are large enough to avoid phagocytosis by the macrophage, but at the same time are small enough to be easily injected with a needle without blockage. They do not cause lumps under the skin due to their round and porous shape. Okay, this is the comparison between the structure. And why hybrid? Well, this is repeated. This is we call hybrid because it comes all together in the same vial, the polylactic acid with the sodium hyaluronate. This is non-cross-linked hyaluronic acid. Okay. Okay, I'll go on. The preparation, important. We have talked about there are not consensus about the preparation in all of the polylactic acid, not only in Lenisna. The proposal of the company is traditional 24 hours before treatment or with vortex 30 minutes. In the case of Lenisna, 2 ml lidocaine, 8 ml water for injection. Okay, the quantity depends on the area of the skin to be treated. The surface of the area to be treated is decisive for the volume of polylactic acid, of course. Usually, we need at least 2 sessions per patient with an interval of 4 weeks. And we are talking about 1 vial per decade when we are talking about facial treatments, okay? What does it mean? If we have 50-year-old patients that have never treated, maybe we will need 5 vials of Lenisna, 1 vial per session, 5 sessions, 1 per month. I have never done 5 sessions. Usually in 2-3 sessions is enough to see a good result. But you have to compare with hyaluronic acid fillers, for instance. If you want to fix a 50-year-old patient's face who have never